Okay, so now we're talking about deeper muscles. Okay, when we talked about it on this side, they were what? What were the deep muscles on this side? Okay. What was the one that was up here? Pronator, then you had pronator quadratus, then you had ones that went to the thumb. So again, now we're going to have to talk about other functions that are going to be supination, pronation, or something like that, and then other specialized fingers like the thumb. Okay, and then in this case we have one. Depending on what side of the tracks are you on, if you're road rage, you might use a different finger, but if you're pointing at something, you commonly use this one. So we'll have a special extensor for this one. So now we're still in the extensor compartment, so they're going to be more over here, but now we're talking about deeper muscles.
Supinator, here it is. It arises from the lateral epicondyle, from the annular ligament, and from this ridge on the ulna, the supinator crest. It's inserted on the radius, along a line ending just above the insertion of pronator teres. The deep branch of the radial nerve runs through the supinator. It enters here and emerges under here. Here's the action of supinator. It's a nice match for pronator teres.
So basically it's going to come from around this side and it's going to wrap over onto the front of the humerus, the radius, and pull it over like this into supination. Okay. So again, these are some of the deeper muscles. And then now again, we're going to have some special ones for the thumb. Okay. So we're going to have the abductor pollicis longus. So that's going to be in the posterior surface of the middle of the radius. I don't know if this is yeah, it's kind of sharp. So you can draw it in on your thing right there. So again, here's a little bit of a discrepancy. This one's showing it coming off of the ulna, but in the text it's saying that it's coming off of the radius here. But the main thing is that it's in the middle portion of the forearm like this. Okay? So it's coming off the radius ulnar or the interosseous membrane or a combination thereof, and it's coming in here to the base of the fifth rib. Right? And this is going to be one of the muscles of the anatomical snuff box. And we'll go over that when we talk about palpation. But well, we can do that. Well, let's do the other thumb muscles and then we'll talk about it. So now you can have extensor pollicis longus and brevis. Okay, so they're going to extend the thumb. Right? That's why they call it extensor pollicis. So then there's going to be two of them. That's why we have a longus and a brevis. Which one do you think is going to go to the left, all the way here to the end of the thumb? Longus. So then where would the brevis go, do you think? The base of the proximal phalanx. Longus is going to go to the base of the distal phalanx.
Is that true for like anything that's brevis will go to the base?
Not necessarily. It just means it's going to be longer or shorter. Okay. In this case, this is what makes it shorter. One of the things that makes it shorter. Because longus is starting from higher up and going farther down. Okay, so on these muscles, if you're looking at the back of your thumb like this, you've got the anatomical snuff box. You've got tendons on either side of it. Okay. The one that's more towards what we call the ulnar side is going to be the extensor pollicis longus. Because if you look at your thumb, when you extend it like that, you can trace that tendon, and it goes past this joint. It goes all the way up into here. Okay? We'll go around and do that with palpation, but this muscle that's on the ulnar side of the snuff box, understand, I realize it's right here over the radius, but it's more closer to the ulnar side than these tendons are. So this is the radial border of the snuff box, this is the ulnar border. So on this side, we're going to have two tendons. Okay? If you go into the snuff box, you come a little bit to the side and palpate, and you can split that into two different tendons. Okay? One of them that's closer to your palm only goes here to the base of the fifth met. That's going to be what? The abductor pollicis. And then the abductor pollicis brevis is this one that goes up here. Okay? We'll go over this again. We'll come around and we'll do it with palpation. Okay? But basically, the one on the ulnar side that goes over here, that goes all the way to this, is the extensor pollicis longus. And then here you have two tendons. One that goes to the base of the thumb is abductor pollicis, and then the extensor pollicis brevis goes to here. So this is the brevis right here, and then this is the longus. And this is one side of the anatomical snuff box, and this is the other side. And I think this is going to show all the extensor muscles. But, so now let's talk about this extensor indicus. So what finger is it going to go to? This one. So here, again, now we're getting farther down. We're talking about more distal muscles, more deep muscles. So it's going to come here, and then it's going to be on the ulna, and then maybe the interosseous membrane, and then it's going to go all the way to the, I think this actually is the middle phalanx. Yeah, so it's proximal phalanx. So yeah, what's that movie? City Slickers, right? The one thing, right? One thing. I should have said, yeah, it's the extensor indicus muscle. That's the one thing in life.
Extensor digitorum pollicis, which arises from the common extensor tendon and thereby from the lateral epicondyle. As it passes distally, it divides into four slips, which pass together under the extensor retinaculum. We'll follow them beyond there in a minute. The extensor muscle to the little finger, extensor digiti minimi, arises from the ulnar side of extensor digitorum and passes under the retinaculum by itself. The extensor muscle to the index finger, extensor indicis, lies deep to extensor digitorum. It arises from the ulna and the interosseous membrane. Its tendon passes under the retinaculum along with extensor digitorum. Emerging from beneath the extensor retinaculum, the extensor tendons fan out. As they approach the MP joints, they branch and rejoin in an irregular fashion. Extensor indicis and extensor digiti minimi join the respective extensor digitorum tendons as they reach the MP joint. Here at the MP joint, each extensor tendon gives rise to the extensor hood, then divides into three parts, as we saw when we looked at the extensor mechanism a little while back. The extensor muscles produce extension at all three joints of the finger. Their main effect is at the MP joint.
So when he talks about all the different hood and all the things with the tendons back there, don't worry so much about that. Just understand that these are going to extend the fingers. I don't know if we have extensor digiti minimi in the list of muscles for in the notes here, but you can tell obviously that's just going to be one muscle that's going to go to the little finger. All right, so then this is just a summary of the different muscles of the forearm, right? What are the two compartments we talked about in the forearm?
Anterior and posterior.
Anterior and posterior. What is the general action of the anterior compartment?
Flexion.
Flexion. And where do most of them originate from? Medial of the condyle. Okay? And then you have then there's going to be, the deeper ones are going to be ones that go to more specialized movements and different things like the thumb and other fingers. And then on this side, what's compartment is this? Posterior compartment, what's the general action of most of those? Extension, what's the general origin point? Lateral condyle, except you have other superficial ones, deeper ones that are going to be things like actions like supination,